Thank you for having me here today. I'd first like to begin by acknowledging the traditional owners of the lands on which I'm presenting from. It's the Wurundjeri people of the Kulin Nation, and I pay my respects to the elders past, present and emerging, as well as Aboriginal and Torres Strait Islander people with us here today. I probably bit off more than I could chew for a 15-minute presentation with this topic, but I'll try to get through as much as I can. I've really narrowed it down to speaking about Generation Victoria's design and recruitment processes as it relates to our inclusivity. And I'll start a little with about what Gen V is. So we're a whole of state cohort. We're open to all children living in Victoria who were born between October 2021 and October 2023 and their parents and guardians. Our participants consent to a collection of biosamples, either directly from the participant themselves, or we also collect residual clinical samples, such as the child's newborn HREC sample. We also consent to the linking of administrative and services data set and collection of data directly from participants. So we do this via surveys on our GenVME app, and we'll also have in-person assessments later. So first we hope to begin those in early primary school. We also have our integrated studies, which can be studies that are working alongside Gen V, where participants are co-participating in both, and we have data sharing agreements, or they can be studies that are completely embedded within Gen V itself. And we bring together our rich statewide cohort together with national data sets to create a powerful, flexible research platform. Researchers will be able to apply to access this for discovery research and work with us to develop interventional research as well. Our vision is that by 2035, we will be helping to solve some of the most complex problems faced by children, parents and families. So where are we up to? Well, as you might have heard from another one of our team members, Kate White, yesterday, we have over 123,000 participants now, including over 49,000 child participants. And we have found that we've had great representation right across Victoria, including families from regional Victoria and some of our most disadvantaged areas. We also have diverse representation across culture and language. And I'm going to delve into a few more of these along the way. But how have we got here? Well, Gen V is underpinned by our 6 guiding principles that help us along the way with all of our work. And one of those is inclusivity. These might be listed second, but it's probably the one that I think of and work with and talk about probably most in my day-to-day work for Gen V. And when it comes to inclusive consent, we're talking around really the design, first of all, and then how we've put this into action. So right from the design, we look to how traditional birth cohort studies were done. And many of these, as you'll know, have often been studies of mothers and their babies. They've been largely healthy families, English speaking, and living in metropolitan areas. Now, of course, that's not all birth cohort studies. Lots have done much better than this, and we've learned a great deal from those in then how we've gone on to develop and design Gen V for what it is. And I'm going to work through a number of these different areas to make sure that everyone is across then how we've gone about making sure we have inclusiveness in our design. First of all is the who. So looking at who is eligible to join Gen V, it's really quite simple in many ways. So for our child participants, you just need to be born between October 21 and 23. So it's a 2-year window, and living in Victoria at the time of recruitment. The parents and guardians just need to have a child who's participating in Gen V, and our minimum participation is 1 child and 1 parent and guardian. But that is a minimum. We are actively wanting more than 1 parent guardian to join Gen V, and we are pleased that over 50% of families do have at least 2 or more parents taking part. We also have lots of families that have more than 1 child, and that can be because we include multiple births, and also we have siblings who have also been born within our birth window. An important part of our consent is that parents and guardians aren't just consenting for their child to participate in Gen V, they're also consenting for their own individual participation. And this means that we not only have a really large child cohort, but we have a really large adult cohort as well. So this means that not only will we be able to watch as those children grow from infants into adulthood, but we'll also be able to watch as those adults grow through midlife and aging, making it a really, truly life course study. Now, we're just circling back to eligibility. We had to think about what we meant by a parent guardian. And again, we just looked at this from that inclusivity lens and really made sure that all types of families, all types of parent guardians were going to be eligible to join Gen V. Moving that into action, then, of course, it's a whole other thing. And just to step into one area, we wanted to make sure that there was no assumptions that our recruiters that were holding when they went into those conversations with families. If they walked into a room that looked like this, there was no assumptions that they were actually speaking with mum, father, and baby, but instead that they had those prompts and conversation starters that allowed them to have those really meaningful conversations with families to understand who they were talking with, and also being really encouraging of those other family members to join if they were only talking with one parent at a time. We were really conscious that fathers in particular have been neglected in this kind of research before and sometimes even actively excluded. So we developed materials that were specific for fathers and really helped to try and for them to really understand their value to this kind of research and that we really welcomed their participation. And we're pleased to say that that work means that we have over 50,000 boys and men who are part of Gen V, which will really open up huge possibilities for research into the future for men's health. Now, of course, this wasn't without many learnings. Just to touch on a few. First of all, thinking not just about what parents and guardians would be eligible to join Gen V themselves, but which of them could consent to their child was something that we really had to work through. And we were really grateful for the Royal Children's Hospital Ethics Committee who helped us work through a lot of these issues, as well as many others. Also, as I've mentioned, the language that we used and how we spoke about families and parents and guardians are really important, not just in those interactions, but throughout our recruitment materials, how we were collecting data and doing follow-up communications. We don't always get it right, but we're always open to learning new things and improving on our systems and processes. The same can be said for our IT systems. We did have challenges where we would go out into the field with the systems as they were in their sort of, I guess, default modes, and really finding that actually, as we met more and more families, it wasn't necessarily fit for purpose, and really working with our platforms team to adapt those systems so that we could use them easily for all of our families. Next up is where. So as you might have seen in another slide, we are recruiting it across Victoria in 58 birthing services, and we're in some of those for up to 7 days a week. We also supplemented this with phone and self-guided recruitment for families who we might have missed in hospital or who weren't ready to join at the time. And this means that we've also been able to get out really well to those regional families, capture people who might have only had a very short stay in hospital or who had a home birth. I've also mentioned that the child needs to be living in Victoria at the time of recruitment. What this means is that actually families who have a child who was born within our birth window but later migrate into Victoria are eligible to join. It also means that families who think that they might be, who are living in Victoria now but think they might not be later, are also eligible to join as long as they do so at the time that they join. This means that we'll be open to lots of new participants in the future, including immigrants. And we've also been able to make sure that those families who are on, say, a temporary visa, like refugees and international students, have also been eligible to join. We've also had a presence in our NICUs and special care nurseries, which means that we've been really able to make sure we cover that full spectrum of illness to wellness. Now, I could probably go on for a really long time about the learnings that we've had in being across those 58 sites across the state. But just to touch on the very tip of the iceberg, as there might be some people in the audience itself who have been part of the research governance approvals that we've had to have across the state, with do thank you all. It was a huge undertaking. We've also had a huge amount of Google team support that we've had to support. So Alicia Galench really led that together with lots of our team to promote that remote 7-day-a-week recruitment. And then just to touch briefly as well on our special care nursery and recruitment, which, as you can imagine, really requires that sensitive, well-timed approach and really a close working relationship with the staff to make sure that we can give those families an opportunity to join. We really do find that they are eager to join once we can get out to them. Next on to the how. So of course we need participant information statements. This is just a snapshot of our e-consent platform. Along the top there you can see we have multiple languages available. Our families can view a short video to understand what Gen V is all about, and then navigate through all the information statement, including drop downs and links to our website to find out more about Gen V. We also aim to provide all of our information to a grade 6 or less reading level, so it's accessible to as many people as possible. In terms of language translations, we're lucky enough to be able to translate all of our recruitment materials into 25 different languages, which we estimate covered over 98% of our target population. And we also offered our recruiters lots of different ways to provide interpreting services to our families as they went through recruitment. And this means that we've been able to recruit a really diverse range of families, including many who speak a different language other than English at home, actually over 70 different kinds of languages. Again, as many of you would know, this has lots of different learnings involved in it and lots of different challenges, particularly with the time and cost of doing this. But we've also had some really valuable things. Our multilingual staff were really integral in being able to provide recruitment in different languages, but also to support making sure that all of our materials were translated to a really high level. We've also learned a lot about writing in plain English is not just important for our English speakers, but it's really important to making sure that translations are done well. Things like colloquialisms that don't work well in translation are important. We also learned a lot about different IT systems that may or may not be able to support translation. You might have noticed in our snapshot that there was only 5 in our e-consent platform. That's because it was all it would support, and we ended up having the remainder of the languages in paper. Lastly, I'll just quickly, on my last one is when, and the answer is anytime. The door is always open at Gen V. Until recently, we had our Catch Up Complete team led by Liz Gleason working from home, contacting people by phone and sending messages to make sure that they could join Gen V, even if they'd missed us in hospital. And we have materials out in lots of different services to let people know they can continue to join. You can go to our website, let us know you wanted to join, and we'll be in touch to let you know how. And so even since October of 23, when our last babies were born, we've had over 9,000 participants join, and we really hope this will continue to grow over time. So to finish up on a quote, because we all love a quote, our inclusiveness we really think about is not just about making sure that people can fit into our research box that we've already created. We really want to make it a new space and a better space for everyone, so everyone has the opportunity. A big thank you to our team, collaborators and partners, and especially to our families. Thanks.
Thank you so much, Libby. And we, of course, applaud the efforts to increase inclusiveness in research and the extent you've gone to. Libby, just one question, just because of time, and that actually came from yesterday. So 2 things maybe. How do you manage ongoing consent for Gen V users? And yeah, I'll let you answer that one first.
So how do we manage ongoing consent for?
Yes. Will you ever reconsent, or will be a set and forget?
Definitely not set and forget. In terms of our consent for our participants, we do want to make sure it is an ongoing consent. So we try to keep everyone informed about what we're doing. So there's different channels for that. So we have a regular newsletter where we let people know what we're working on. We also keep our website up to date, and we continually will be adding to that what data we're accessing, what samples we're accessing, and then later how people's data are being used as well.
Okay, another question. Funders funding the full cost of inclusive recruitment processes. How are you managing that? Do you get pushback from funders? Do you manage to incorporate the cost of being inclusive into any grants, etc.?
Yeah, absolutely. Good question, because I think earth cost is one thing that is prohibitive for a lot of research studies. We did have to invest a lot in the initial materials being translated and having that interpreting as well. And the challenge now is to continue that as well. So we've got all these families who have joined who don't speak English, and we need to be able to continually provide them with materials in their language. So making sure that we have the funding for that is important. So when we have grants come up, we do want to be making sure that they're including in their funding a line item or an amount that would allow for that continued support of our translated materials.
I guess one could always ask, but funders can always push back. It's the way it is. One final question, Libby. Does consent at the outset allow you to, or do you need to revisit research data analysis or, further down the track? Is your consent broad enough, I guess, to allow you to do what you need to do in perpetuity?
Yes, we hope so. So our materials and consent were written in such a way as to be inclusive of all kinds of different research that we could possibly envision at the time. And it was, allowing the ongoing things that could come up. But you never know what the future might bring.
Sure.
But we do hope that, what people have consented to is being sufficient to cover most things that we could think about doing.
Wonderful. Everyone, please show your appreciation for Libby's talk. That was, I really love the idea of just being inclusive and getting more people into research. So well done, Libby, and well done, the Murdoch. Okay, now we are going to.